Greetings, greetings, greetings. It's New Zealand naturopath Eric Bakker, author of Candida Crusher and a formulator of the Candida range of dietary supplements. Thank you for checking out my video. We're going to talk about Helicobacter pylori today. So I'll probably end up doing a few videos on Helicobacter. It's such an incredibly endemic problem. So many patients we see in the clinic have got H. pylori, and so many patients are misdiagnosed. Testing is always not very accurate with HP. In many instances, I've noticed that patients come back positive with the symptoms. You swear they've got the condition. They go and get a stool test or a blood test. It comes back negative, but when you treat them, they get the result. I've seen this time and time and time again. It's amazing. It's nice to have a test confirmation, but in most cases, I will just treat the patient for Helicobacter if I suspect Helicobacter. So back in 1984, Australian doctor, Dr. Barry Marshall, discovered Helicobacter. Working in the lab, he started to wonder why so many people were getting gastric ulceration, heartburn, peptic ulcers, and discovered that there was a spiral-shaped bacteria involved. And I think it was originally called Campylobacter pylori, but then the name got changed to Helicobacter. Helico as in, I think, a spiral or a helicoil. And it's an incredible bug, and it is endemic in many countries around the world. In New Zealand and Australia, 25% of the population are infected. In the Northern America, I believe it's about 25 to 30% of population. In some countries like Africa, it's up to 90% of the population. So not everybody who is infected will necessarily be symptomatic. Some people are asymptomatic, which means they're not necessarily presenting a symptom. They could be carriers. And many people who have got it will certainly notice the symptoms, which could be burping, could be bloating. Often it's digestive discomfort with eating certain foods, so certain foods won't agree with that person. That person may have been taking some type of an antacid or an acid blocker for a short period of time or for many, many years. So once you've got Helicobacter, you've generally got Helicobacter for a long time. The key issue we get with it is heartburn. It'll be like GERD, a GERD kind of a symptom, gastroesophageal reflux. So you could have like every now and then hot stuff or sour stuff coming up. You could feel a discomfort here behind the sternum, sort of in the part of the chest here. You may feel really uncomfortable, and especially after eating. You may find that standing or sitting or changing position could increase or decrease the discomfort. You may find that by taking an acid blocker, you get a lot of relief of this symptom. If you've got HP, have a look around your family and friends to see who suffers from a similar kind of problem, because in some cases I see it often in relationships. It'll be in family relationships, or your mum could have it, or your dad, or your auntie, or your sister could have it, or your husband or wife could have it. It's quite common for this bug to be spread with utensil sharing or kissing. It can be spread, so just be careful if you've got it. If you've been taking a medication for many years to block acid, you may well have Helicobacter pylori. So my advice is to go and get tested on the off chance that they pick it up. And if you don't get tested and if you get tested, it comes back negative, and you can relate to Helicobacter pylori, then my advice is to treat it. Even if you just treat for SIBO, small intestinal bacterial overgrowth, you may end up finding a very, very good result. So chances are, if you've got bad GERD or reflux and you're taking a blocker, and if you treat it, if you get a very, very good outcome, my advice is to slowly wean off the acid blocking drug and to take more of an antibacterial, antifungal approach for 3 to 6 months of trying to eradicate all this rubbish you've got up here. It can change your life. Many people with H. pylori end up with a lot of tiredness. And it's no wonder they get tired, because they end up getting a reduced ability to really break down and absorb and utilize the nutrients coming in through the food. It's like starving an automobile of gas, petrol going into the carburetor. If you're going to starve that, the vehicle, the power to the wheel is not really going to happen properly. So your muscles aren't going to really feel good if you've got Helicobacter long term. Your sleep's not going to feel good. Your mood's not going to feel good. You're going to feel grumpy. You're going to feel pissed off. You're going to feel tired. You're going to feel you're getting older. You're going to feel a lot of discomfort. And then your doctor's just going to keep writing out prescriptions for these darn acid blocking medications. So The drug Nexium in the US is a typical example of an acid-blocking drug. It netted the pharmaceutical company $6.1 billion in 2014. That's one drug for one symptom. Now, there's about 10 drugs, all in the top 10. So we're looking at literally $1 trillion worth of pharmaceutical drugs each year in North America alone, just to block stomach acid. Now, my guess is that 1 in 3, 1 in 4 of those people have got HP. So think about it. If you've got heartburn, reflux, burping, bloating, sick after certain meals, sensation of fullness after meals, certain foods disagree very quickly when you eat them, there could be some queasiness or nausea there. You may find discomfort when lying in bed at night. You may need to prop up the bed head with some people put a brick under the bed head, it makes them feel better. If you want any of those kind of symptoms, you need checking out. If you have HP long term, you'll end up a very sick person on multiple medications, multiple diseases. HP is often found in conjunction with Candida. Candida, like other kinds of bugs, is opportunistic. If it sees the opportunity, it will start taking off and growing. My guess is that many people with Helicobacter also have very poor levels of beneficial bacteria. They have yeast infection in the body and other associated gastral problems. And the reason why is because they've been on medications for so long. They take acid blockers, and some take sleeping pills, and some take antidepressants, and they take all this cocktail of drugs, and then they wonder why their whole insides aren't working properly. So the big thing is to wean you off this sort of stuff, long term, so you don't need to rely on it, and eventually get you off all medications, so your body can run on its own steam, produce its own power, with the good diet that you're eating, and it will turn your whole life right around. I've seen this with many patients over the years. Consider taking the Candida Remove tablet. It seems to be working very well for Helicobacter. It's a product I initially created for Candida yeast infection, but we're getting very, very good feedback from people with Helicobacter pylori, with parasites, many different kinds of parasites responding to that product. Candida, of course. So I'm using it for SIBO patients as well, very successfully, food allergy patients, leaky bowel patients, all sorts of conditions. But I'm also noticing good results with Helicobacter pylori with the Candida Remove. The Candida Restore is a fantastic companion product because everybody I find with Helicobacter will have a lack of beneficial bacteria. Everybody with Helicobacter will have an issue with digesting food properly. Their pancreas doesn't function properly. That's because they keep putting these acid-blocking medications in the stomach, which changes the pH, the acidity of the stomach, which renders a lot of the pancreatic enzymes ineffective. So taking a digestive enzyme with meals when you've got HP is a very, very smart idea, especially if that enzyme contains probiotics at the same time. I don't recommend you take prebiotic supplements like inulin or FOS with Helicobacter. I've had too many bad results when it comes to that. And these are some of the reasons why I created Candida Restore, because I wanted to give the patient a product containing high quality enzymes, high quality probiotics without FOS, inulin, or any of that prebiotic crap in there. That causes too much nausea, bloating, sick feeling, so I've taken all of those out. The Candida Restore with Helicobacter is best taken one with each meal, breakfast, lunch, and dinner. The Candida Remove, the antifungal, antibacterial, is best also taken with meals. They work perfectly fine together. They don't cancel each other out at all. So you can take the Candida Remove twice per day initially, and the Candida Restore you can straight away take 3 per day with meals. If you start noticing increased acidity, burping, and bloating on that regime, you just back off by 1 dose. You can still take your acid blocking medication at the same time, and slowly you can be weaned off that. A very, very good tip that I'm going to leave you with, the last tip, and a very, very worthwhile tip that's helped a lot of people out. I want you to get some green cabbage and then juice 1 or 2 cabbage leaves every single morning. Okay, so when you get up, you juice 1 or 2 cabbage leaves in a juicer or a blender, and you extract 1 to 2 tablespoons of the cabbage juice, and you drink that on an empty stomach. It's a fantastic tip. It's a tip that's won me a huge amount of fans in many different countries around the world. I've got a lot of satisfied patients now just from that one tip alone. So that's a real gold nugget for you. If you're taking Nexium or omeprazole or any kind of an acid blocker, you try that tip, and then you get back to me and tell me how you went with that tip. I'll be very pleased to see the comments on this particular video for people who've tried the cabbage juice trick. Cabbage juice goes back centuries for stomach problems. It contains a substance in it which is superior than any acid blocking medication you'll find. Once you use it for a while and you've eradicated bugs, you should have no more problem with acidity in your stomach. That's my promise. But you keep on trying the cabbage juice. Stick with it for about 3 months. Every morning when you get up, 1 to 2 tablespoons, empty stomach. Some people respond to potato juice, but I find the cabbage juice to be superior. Thanks for watching my video today. Appreciate it.